Former President Joe Biden has been diagnosed with prostate cancer. This news broke yesterday. His office says it is an aggressive form of cancer, with the cancer cells having spread to the bone. Prostate cancer, second only to skin cancer in men. According to the CDC, for every 100 males, 13 will develop prostate cancer at some point in their lives. Joining me now to talk about this is Dr. Majoj Bupathi, an oncologist with HCA HealthOne. And doctor, we appreciate you being with us.
Thank you so much for having me.
Yeah, we appreciate the time and talking about this. President Biden, of course, the president has been wondering about prostate cancer. We're being told it's a hormone positive diagnosis. So what exactly does that mean?
Yeah, prostate cancer has two parts to it. It's either considered hormone sensitive or hormone resistant. Hormone sensitive is considered a more favorable diagnosis. It's usually when the testosterone levels are considered to be normal, but the PSA is elevated. It's usually considered the first time a diagnosis when an individual is found.
When they say this is an aggressive form of cancer, what does that look like in treating something like this?
Aggressiveness of prostate cancer is typically based on the Gleason score. The Gleason score is dependent anywhere from 6 to 10. The higher the number, or closer to 10, the more aggressive the cancer is. And Joe Biden's was at 9, which is the reason why it was mentioned as more aggressive.
And when they talk about it being in the bone or spreading like this, does that typically go with that number on the Gleason score? Does that typically mean that it's spread?
Yeah, so Gleason score of 9 definitely indicates aggressiveness, but it doesn't necessarily indicate location of spread. Okay. Prostate cancer most commonly goes to the bones. Having it going to the bones is consistent with the stage 4 diagnosis, which is considered more incurable.
Now, the president, we know, was out of the recommended age for screening. So what are some advice or warning signs for those who aren't being screened?
Yeah, it's really an individualized decision from a screening standpoint. Generally speaking, any male over 50 should be having a conversation with their healthcare physician or provider to talk about screening for prostate cancer. Usually it's urinary symptoms, hesitation to complete urination, increased nocturia or nighttime urination, blood in the semen or urine. These are some signs that can indicate there's some abnormality. In addition, family history is also really important. So if there's other individuals in the family that have been diagnosed with prostate cancer or any other breast cancers or ovarian cancer, it is important as well.
Doctor, do you find that people are just hesitant to, to go in and talk about something like this as you treat men?
Yeah, I think men are more resilient to some of these symptoms. We tend to often blow it off, right? So I think it's, but it is an important conversation.
Okay, well, thank you so much for your time and breaking this down a little bit for us so that we can all understand it a little bit better, and just go get checked out, right? Any questions? I mean, that's why we have such great, fabulous health care here.
Absolutely.
All right, thank you so much. And if you would like to check out any other of our interviews with health experts, we have them all for you up on our website at cbscolorado.com.